Hi, I'm Dr. Santoshi, consultant dermatologist, Aesthetica Veda, Whitefield, Bangalore. So today I'll briefly touch upon easy to put together skincare for patients with acne. So acne is a disease of the pilosebaceous unit. In layman terms, it's a disease that originates from the hair follicles, okay, and it can cause significant psychosocial morbidity and loss of self-esteem, etc. It starts in a very sensitive age during adolescence when children are discovering themselves, furrowing into adulthood. So at that stage, any kind of physical disfigurement can wreck someone's self-esteem. So it's all the more important to treat acne with care to make sure that it does not leave behind permanent long-lasting damage. What we fear more than the acne itself is the acne scarring. So that said, a simple routine would look like this: using a cleanser, okay, and this cleanser, if you have oily skin, preferably use something with salicylic acid, because salicylic acid is lipophilic in the sense it loves lipids. It's going to penetrate through the lipid layer on top of your skin in between the cells, and it will get rid of the excess oil, sebum, etc. And it's also a keratolytic, meaning it will break down the dead layers. Acne happens when the dead layers accumulate and then the sebum gets trapped, and then the bacteria come and sit in and the inflammatory cells get recruited. So salicylic acid cleansers are a first great step to start with. And leave the cleanser on your skin for at least a period of 30 seconds, and then first wipe it off with a cotton pad and then wipe it off with water if necessary. Right after washing your face, make sure that you dab it dry. Do not aggressively rub it with a turkey towel or an abrasive towel. Dab it dry with something gentle, preferably a cloth that you reserve just for your face. And after that, in the morning, a vitamin C serum, although recommended for morning usage, for acne prone people may be best avoided. Instead of a vitamin C serum, you can use a suspension of azelaic acid that has anti-inflammatory, anti-comedonal and antibacterial properties, and it is gentle enough to be used in the morning, provided that you follow it up with a good sunscreen. Next comes the usage of a moisturizer. Do you always need to use a moisturizer? Not necessarily. If your skin is oily, acne prone, and if you do not have very dry skin, then using a moisturizer is probably going to do more harm than good, especially if you live in a humid climate. Okay, so you may want to follow it up with a sunscreen. You must follow it up with a sunscreen. Most sunscreens also contain some kind of moisturizer, so that could well be enough. The sunscreen that you're going to use should be non-comedogenic, should have the adequate SPF, at least SPF 30 to SPF 50, and it should be applied half an hour before you venture out into the sun, and should be reapplied ideally 45 minutes into the exposure, if not at least every 2 hours. And especially for people prone to acne and pigmentation, a mineral sunscreen is your best bet, especially one containing iron oxide, which you can identify by sunscreens which have a tint present in them, okay? Because tint is the visible tint provided by the presence of iron oxide is what's going to protect you from visible light, all right? Blue light, things that are omnipresent in this day of technology, from your phone, from your laptops. So those lights, they can contribute to pigmentation. So people with both these conditions will benefit the best with iron oxide containing sunscreen. And following that, of course, you can go about your day. Anytime that you sweat, you work out, and you find yourself with oily face, you can always wash your face again, all right? Then at night, never forget to take off your makeup. Never forget to take off the day, so to speak, from your face. Wash up your face and you can apply an active. So now actives consist of, for example, if you have a lot of comedones, you may want to go with the product containing benzoyl peroxide, all right? It comes in various concentrations. 2.5% is a good concentration to start with. Now, if you also have concomitant inflammation, some few pusful lesions, clindamycin topical along with benzoyl peroxide is a good combination, all right? There's also adapalene, a new age retinoid that can be employed. This is also a great molecule in the sense it's a keratolytic. It will make the sloughing away of the dead cells of your skin. It will regulate that and make sure that the cells do not block the pores. So retinoids can also be employed, but again, retinoids will increase the chances of you developing a sun sensitivity the next day. So make sure that if you're using a retinoid or a glycolic acid preparation or any kind of keratolytic, that you follow up with a sunscreen the very next day, all right? And retinoids have to be used cautiously. They're not something that you want to lather your face with, more like a pea-sized amount, and should be applied. You can use the sandwich technique, which is first use your moisturizer and after 10 minutes follow it up with a pea-sized amount of the retinoid of your choice. It could be adapalene, it could be tretinoin, it could be tazarotene, it could be trifarotene, and again 10 minutes after absorption of the cream, follow it up again with the moisturizer. The moisturizer moisturizer you use, needless to say, has to be non-comedogenic, and ideally it should also be preservative and fragrance free. Alright, thank you.